Hello, this is Vicki Molta, and this is You and Your Mental Wellness. This show is about just dispelling the stigma of mental illness and having people on the show come on that are either living or working with people who have mental health issues, and showing them that they can live full lives, and that just dispelling a lot of the negative things that come up when someone is labeled with a mental illness. And the theme tonight is persistence, because a lot of people who have mental illness have a lot of losses, and we're going to talk about that tonight too. And it's amazing how much they've lost, but they continue to persist in spite of the losses. And what I wanted to have Cindy Carloni on the show because she has persisted through a lot of challenges in her life, and she's a grief counselor, and she works with people who deal with a lot of losses, and she's also a manager and an advocate within the mental health field. So I just want to welcome you for coming today.
Thank you. Thank you for having me.
Yeah, I wanted to ask you first of all, when did you begin working in the mental health field?
Well, the mental health field probably about 27 years ago. But before that, I worked in the mental health field with children, ran a group home for adolescent girls, and then I worked in a facility for adolescent boys. And about midway through my career, I switched and worked with mentally ill adults.
Mm-hmm. And so over the years, has it changed a lot? Has the mental health system changed? Because I remember I talked to you, I meet with people beforehand, and you told me that it's a lot of it is driven by money, and I think you said something like, I wrote this down, that it's money drives the system, and it's driven by the medical model. And so how do you feel about that?
I think it still does to some degree. I think we've made some progress. I think we're becoming more of a recovery-oriented system, but it's been a long time coming, and it's been a long road. And I think now, just because of the financial situation, budgets and billing and things like that, the focus has shifted more toward money, unfortunately. We don't have enough resources in the community to help people like we should, or that's needed out there, and the need is getting more and more. So I don't know how we could do that with less and less, but we're managing.
Right.
I think we've come a long way. I personally, when I was hospitalized back in the mid-70s, back then they had no services. It was inpatient and outpatient, and then that was it. You didn't have anything, so you either made it or broke it. And
did they have places for people to go to once they got discharged from the hospital, or they would just be put on the streets?
Well, I didn't need that, because at the time I still lived with my parents, but I didn't know of any programs at the time. We're talking 1975. Mm-hmm. That was a long time ago, show my age, but I didn't hear of any vocational programs or residential programs or social centers or anything like that. It was just outpatient. That was it.
Right.
And I know how things were inpatient, and that's what made me want to become a staff person in the system. Someone that was been there, done that, really understood what it was like to suffer with mental health problems and be hospitalized and not treated very well, and I just wanted to make sure that I could make a difference, and so my life's purpose-driven.
This was when you were a young woman and you were in the hospital. Mm-hmm. And it was there that you realized that you could have some kind of a purpose in helping other people, because there were a couple of instances that you brought up that you told me. For example, there was this man, Bill. Do you want to talk about that?
Right. And I'll probably never see the man again, but he was an older gentleman who was in the psychiatric ward with me, who was catatonic, and he had been in there for quite some time, and they told me that he never spoke at all. And I befriended him, and I would sit next to him, and I would just talk to him every day and encourage him, and make a long story short, in 3 months I had him smiling and playing ping pong, and so I kind of knew then that, you know, I had something in me, a strength or an ability to reach people, and I, you know, and I could relate with suffering. You know, I suffered my whole life with major depression, and I have you know, a trauma history, and it, you know, it hasn't been easy. And so I just wanted to you know, you have to find some good to come out of the bad, and that I figured if I could help other people, even if it was just one person, or make a difference, or help change the system, that's what I wanted to do.
It sounds like you really have made a difference in a number of ways too. I mean, there were also you said something about following your. You said, I wrote this down. What sparks people's souls?
Right.
You have to find what sparks people's souls.
Right.
And I think for a long, long time, and I've been around a long time too in the mental health field. Like I started out in the 80s, and you know, I think back then they just were limited in what they believed they thought people with mental illness could or couldn't do.
Right.
And you know, they really walked on eggshells around people with mental illness, and
they didn't believe in recovery.
Right.
Just maintenance, meds and symptoms.
Right, and sparking people's souls, you know, getting to what they're passionate about. And you know, you were talking about how this person we know, Brian, you know, how he had his master's degree in counseling from Southern, and he had mental illness, and you got to know him better, and what happened with that?
Well, basically, he was told that he probably could never use any of his education again, that maybe if he was lucky, you know, he could, I forgot what they told him, sweep the floor or bag groceries at Stop and Shop or something. And I ran a vocational rehab program at the time, and he had come to me, and I was like, what do you mean you can't use your education? Of course you can. You know, your illness is only part of you. And I'll never forget it, and I could share this because he shares it in public forums. You know, the man cried for hours because someone gave him hope, and
touched something in him.
Yeah, and I helped him get his first job in the field, and he did very well. And you know, the rest is history. Now he has a pretty good position working with the state, and he does a lot of great work, and he's reaching a lot of people now. It's very important to be a mentor to people.
Yeah, he was on this show a couple months ago, and he told me that he never forgot what you said to him, you know, about that just go ahead and do what your heart tells you to do. And you know, I think also I was thinking about somebody else that you told me about, a man who was a physician's assistant.
A woman,
Was it
that
a
I
woman?
worked with, yes.
And she was stocking shelves at Kmart.
Right.
And then was she a client of yours?
Yes. Again, the voc rehab program, yeah. Again, I was like, you know, maybe she couldn't be a PA again. She couldn't handle the stress, but she could do something similar with that education. And so, to make a long story short, I helped her get a job as a phlebotomist in the hospital, where she could use some of her medical knowledge and be around medical personnel. And she did that for quite some time. But unfortunately, she was also a person that didn't respond very well to medications, and so we had to think out of the box again, something that the system doesn't usually do well at. But we got a job with her. I don't know exactly the title, but you know how insurance companies have someone go in the home and do like a basic physical examination with people to see if they qualify for insurance. They'll check your sugar and your urine and your vitals, and so she did that, and she can do it around her own schedule. So if she was cycling or she wasn't doing well, you know, then she wouldn't schedule appointments during that time. But again, I helped her learn that these were cycles and they do pass, and she would even track them on the calendar, and so she would know, and her hope was knowing that they would pass, and that, you know, she could plan maybe doing things the week after or the week after that.
Right.
There's always something we can do.
Now, what do you think about disclosure? Because that's a very, very tricky area. Because do you think that there are a lot of people out there that are working that never disclose about their
Oh,
mental
yes.
illness. And how do you, whereas there are a lot of people, it can go to the other extreme too, where we've talked about how now in Connecticut they have all these jobs available to people in recovery, and they call them peer jobs because they're peer mentors, peer employment specialists, peer this, peer that, and that's almost going to the other extreme. So now you've told me that you don't necessarily think that that's the best thing to have
No.
people, label themselves as peers.
I don't think you should have a professional career or job that's based on your illness. I think it should be on your capabilities, and I believe mental health is the only profession that's doing that. I know the addiction side, for years, they hire people in recovery into existing positions who disclose through their positions, whether it be a counselor, therapist, a supervisor, they're people in recovery. They don't have a special peer title. I think that in a way is segregating, and it perpetuates stigma.
Right.
I think we should be encouraging people in recovery to apply to existing positions and disclose. That's, of course, is a choice, and that gets into my career-long debate about whether or not to disclose, the
Right.
pros and cons to that. And I always strongly believed, even when I ran the vocational program, that people should disclose. There's an appropriate way to disclose and time when one should disclose. But I think when we don't, what we're doing is we're feeding stigma too, because we're acknowledging something's awfully wrong with us that we need to hide, that we can't be free to speak about like any other disease or problem someone may be having. And I think if we presented that this is just part of me, it's not all of me, and it's no big deal, and it's manageable, and you can still have a life, that's the message we want to get out there, and we can't get that message out there if we're not talking about it.
Right. And this kind of segues a little bit into, walking on eggshells a little bit, like some people would rather not disclose because maybe they're afraid that it's not professional or whatever reason it might.
Well, there's two things about the eggshells. One is that, the truth will set you free. And, I wouldn't want to be around people that I couldn't be myself with. I wouldn't want an employer that I had to hide, especially if I needed time off or I was sick. I want to be able to be free and be me. I don't want that pressure and that stress. And if I can't have an employer like that, then I won't work, or I won't work for that particular agency. I'll go somewhere where someone will accept me and be supportive of me. And I found that through my career.
Right.
The other thing is the old way we taught therapeutic boundaries, the old clinical model. It was very extreme. I mean, you couldn't even have a picture of your dog on your desk or something. And I think culturally speaking and being culturally competent, as well as the whole issue of disclosure and being a mentor, I think it's how we disclose, and if we do it in a teaching way, in a constructive way, it still can be professional and therapeutic.
Right, because otherwise I think a lot of people would maybe feel alone and not really understood. And it's very healing to maybe have someone who's in, like you said, a mentor position, who's been through and persevered like we're talking about, and is still hanging in there and letting them know that
it's so much more powerful and so much more effective. Take Pat Deegan, Dr. Pat Deegan.
Right.
When staff basically impatient laughed at her when she said she wanted to be a psychiatrist. Well, she is a psychiatrist, and how much more powerful is that to have a psychiatrist share that they understand what it's like to be hospitalized or to not feel in control or to struggle with medications. How powerful is that versus a peer staff person just trying to get you engaged to go to see your doctor? I mean that could work too, but I mean the point I'm trying to make is if we do it in existing professions and existing positions, and disclose in an appropriate way, it's so much more effective and inspirational to people.
So do you think it's a step backward maybe to have these labels with peer being,
Well, not necessarily a step backwards, because they didn't have anything before. So they weren't even talking recovery until like the 80s. So I think step by step we're getting there. I said, but now that they're seeing that, you know, people can work in these positions, and many of them are doing very well, and they're very frustrated in those positions. They want to move up. They want to do other things.
Right.
They want to be case managers. They want to be vocational counselors. They don't want to be stuck in that one position. So I think they're going to see that more and more and more, and then eventually I think just the natural thing is going to take place, and they're going to fill all positions.
The thing that frustrates me is the low pay, which is,
Well, right, that too.
you know, they still walk around with the eggshell thing because they think, well, if we pay you too much, you won't be getting your benefits, and a lot of people.
Well, that's ignorance.
That's a lot
because
of people.
That's ignorance, though, because the work incentives have changed, and thanks to Janine Sullivan-Wiley from the Northwest Regional Mental Health Board and a committee that worked very, very hard, you can work full time and make good money and not lose your benefits. So people that still believe that are not up to speed with what's going on with work incentives in the first
Right.
place.
Yeah, I think, but you know, you wouldn't, Cindy, you wouldn't believe it. Like I know so many people that really, they revolve their whole lives around, well, if I take this job, then I'm going to lose my
Yep.
bet. And to me, that's like
fear.
It holds people back,
Yes, it
you know,
does.
from growing and
Yes, it does.
making money and you know,
Yep.
being part of the workforce. And
When I used to run the vocational rehab program, I used to tell people that the worst thing that could happen is you lose your job, but you stay on the rosters of Social Security for I forgot how many years, and you can get right back on.
Right.
It's not that, you know, it's going to be that long process again. So again, it's just educating people and reassuring people. I think the BRS counselors that are around now that specialize in entitlements are really helping with that, distill that fear, even with the staff.
I
So,
think that's really important.
Very
You know,
important.
people need to know that. And
yeah.
so I wanted to ask you, there are a few other things I wanted to ask you about. One of the things was about your work. You do work as a grief recovery specialist.
Yes.
And that's a big part of your work, and you and you follow the grief recovery model. So if you could just explain a little bit what you do and what the model is. And
Okay. Well, the Grief Recovery Institute has this grief recovery method modality, and it's a curriculum. It's a classroom where you teach people new skills on how to resolve grief. And grief is not just grief from loss from death. It's any kind of loss that people have experienced. It could be if you were sexually abused, like I have been too. It's a loss of safety, trust, security. You could have lost your job. You could have lost your mental health, your physical health. I've worked with people that have lost limbs, people that have lost jobs. There's many types of losses, and our society hasn't prepared people well in how to resolve those losses, and they affect us in the long run through our behaviors and our choices and our capacity to love and to find happiness. And so I'm really invested in teaching this class, and it's been life-changing for everyone who has taken it. I started to get into it when my mother passed. I had helped my mother die. She had breast cancer, and since it was a life-changing moment for me, and it really started to steer me more toward end-of-life issues and grief work. And a lot of the clients, including myself, had to do a lot of resolving of losses. People have a lot of losses, and we don't deal with that very well.
Right.
You know, again, we're mostly dealing with symptoms and medications and things of that nature, and not the losses that people have racked up, and people with mental illness have suffered tremendously.
Right. I think that, you know, in this society, people are considered a burden if they, you know, if they're sad or if they're having a problem or whatever. And, you know, it's so important to be able to express feelings and to cry when you're sad. And
People in general are very uncomfortable with tears and,
Right.
and heartache. And you know, we're taught at a very young age to, you know, to go to our rooms when we cry, or to, you know, have milk and cookies when you learn to self-soothe at a very young age, or to, if we lost our pet, oh, we'll just get you another one, just replace it. But we're never taught how to deal with the feelings of loss. You know, we're taught to grieve alone. we're taught to bottle it up, and it just gets compounded through the years, and it really affects us. I know me, with my diagnosis of major depression, it just made it a lot worse.
Right, and that's how a lot of people end up, abusing alcohol and
Yeah.
drugs and
Yep.
all the other
Yep.
Addictions too,
Right.
because
I've done
the
that
pain
too.
is,
Yep.
yeah, the pain is so
Yeah.
intense.
And then when that don't work, you try to end it all, and I did that at a very young age as well.
Yeah, and
Yep.
but then you decided you felt that God had a higher purpose for you,
Oh,
and
without a doubt.
you persevered, and
Yep.
and you've helped so many people, over the years, to learn to come to terms with their feelings, and
You have to make sense of your tragedy and your journey, especially when it's full of a lot of trauma and negative experiences. You have to believe, and it is true, it's not that you convince yourself of that there's some good can come from it. And so
Right.
I lead what I call, or others call, a purpose-driven life. And if I can help one person, then it's worth it to me.
right. And you
Yeah.
said once that there was one point where you were crying or something, and your father was worried that that you were going to have a mental health,
My mother, yeah.
that you were going to get sick
Yeah,
again.
you're gonna. Yeah,
I think that's
anytime you show emotion, whether it be tears or anger, because I used to have a lot of anger issues, still do with some things. But people right away like, oh, you're gonna get sick again, or oh, you're
Right.
gonna
Or
don't
did
make
you take your
waves,
medication,
or even now with the grief class, clinicians will say, oh, I don't know if they're ready, or you don't want to open up a can of worms, and that's exactly what you want to do. You want to bring up all those feelings, all that pain, and help them deal with it in the right way, and let
Right.
it go. That's the only way you can let it go, is to let it up
right.
and out.
And a lot of people
Yeah.
just kind of tiptoe around that
Yep.
because they're afraid that some kind of terrible thing is going to happen.
And nothing happens. You know how many people I've sat with for hours with a box of tissues and just let them cry. And then not just leave them like that, but then you got to give them the new tools in their toolbox to now, have closure and wrap it up.
Right. So it must be a very, like you said, the grief never really always goes away, but
Right.
you are freer, and
Right.
it's like you said, like the layers of an onion. It's
Right.
like the layers get, slowly.
You peel them
Peeled
away
away.
one by one. That's right.
Now we only have a few more minutes, but I wanted to quickly bring about your book called Saltamatine.
Yes.
You wrote a book. Saltamatine is an Italian nickname meaning grasshopper, right?
Right.
Which means that you're full of energy and
Was my nickname when I was a child, because I had ADHD and I was very, very hyper, and my grandmother called me that. So the book is about a generation of 5 Italian women, basically my family history, which they all suffered trauma of one type or another, and how to survive that, and how to break the cycle,
right.
and give people hope, and how to forgive.
So you really you feel that your generation pretty much broke the pattern of
Definitely.
of abuse, and I read the whole book, and I really realized that that some of the relatives that you had, they were married to people that they didn't love. The people that they loved had died, and it goes back into loss again too, and
Yeah.
loss of moving to America and not being in Italy anymore, and
Yeah.
their homeland and everything like that. That's a long. There's a
Yeah.
lot I want to talk about. I'm
Yeah.
thinking maybe I'd love for you to come on again, because there's so much. But I just wanted to ask you one final thing.
Okay.
You said that there were some people that really helped you along the way. Your aunt, what was your aunt's name?
Beecha. We call aunts Sia, and so it was, her name was Beatrice. We called her Beecha, and she was just someone in my life at a very young age. Her and my sister Donna, that I experienced some kind of love and support from. That was very helpful to me during very difficult times during my childhood, because my family was extremely dysfunctional. We had a lot of mental illness in my family as well, on top of the sexual and physical abuse. But then I met people in my career along the ways that gave me a chance, and that
Brenda
supported me.
from-
Brenda McGavern, I wish I could find her. She gave me my first job at the group home.
Right. She
I want to
believed in
thank her.
you.
She let me live there with the girls,
Wow.
and she really believed in me.
So you passed that down to the
Yep.
people that you work with.
Yep, I
because
try.
people believed in you.
Yep.
And then you passed that positive, thing down to the people that you worked with, that you
Right.
believed in them too.
Right, and just to never give up. You can't give up.
Right.
Something good will come.
Right. So this show is about persistence, and I feel like I want to ask you a lot more questions, but
Maybe I'll be more relaxed next time. A little
no,
nervous.
everything was
A
fine.
little different for me.
But you're very forward, very, very progressive in your thinking,
Mm-hmm.
which I wish more people could be that way.
It's hard to be that way, but
Yeah. So we're just going to close now, and thank you for coming on my show. And
welcome.
I want to thank Josh for doing the camera work, and Madison Cable Access, and all the people out there who are watching. We'll be back next month, and hope you tune in. Thanks.